and colonoscopy done. There is a pathology picture that you're going to be provided with. Sorry about the lines. Can you describe what you can see there?
I can see the wall of the colon is studded by numerous polyps.
Yeah. So yeah, you can see multiple polyps. That is definitely will be more than 100 in type, and here you're going to say that multiple polyps, likely more than 100, suggestive of familial adenomatous polyposis, but further pathology will be needed. Okay. All right. Next is, what is a familial adenomatous polyposis?
Familial adenomatous polyposis is an autosomal dominant condition in which it is characterized by the colon will be having numerous multiple polyps, which are usually more than 100.
Yeah. So familial adenomatous polyposis is an autosomal dominant loss of the APC gene, the tumor suppressor gene, and characterized by development of more than 100 polyps. All right, fine. And what are the classification of polyps?
Okay, so we can classify it into infective and neoplastic. Neoplastic polyps can be tubular, villus, and tubulovillus polyps.
Yeah. Is there any other classification that you know of?
Also, there are benign and malignant polyps, and benign could be like hamartomas or hypertrophied polyps.
Yeah, so you can say the neoplastic and non-neoplastic and inflammatory. The neoplastic can be further classified into villus, tubular, and tubulovillus. The non-neoplastic will be the hamartomatous and metaplastic, and inflammatory polyps, which happens due to chronic irritation or happen due to certain pathologies, including ulcerative colitis and the pseudopolyps. Okay, so instead of just saying benign malignant, you can do benign malignant, which is absolutely fine. You can mention the villus, the tubular, the tubulovillus, but those are just one type. And I think if you just say that, you will lose a mark because you haven't mentioned the bigger picture. What are the malignant potential of an adenoma depends on?
Depends on the type of the adenomas and the type and the size of the adenomas and the differentiation as well.
Yeah, so you need to give me examples. So in terms of size, what happens? You said it depends of size. What exactly happens? Which size will lead to cancer?
I think if it's more than 1 centimeter, so it might be having a malignant potential.
What do you mean? More than 1 centimeter or
in diameter, I think.
Yeah, so more than 1.5 is likely to be to increase the risk of cancer. All right. So I would say between 1 and 2 is the highest risk, and more than 2 is almost a definite risk. It's risk of 20%. Type of adenoma. What type can lead to carcinoma?
It's the villus adenoma.
Yeah, villus, tubular villus, and also the tubular type as well. And finally, the degree of dysplasia. Okay. All right. What are the extraclinic manifestation of familial adenomatous polyposis?
There is a Gardner syndrome and the Turcot syndrome. The Gardner syndrome would be characterized by mandibular osteomas and desmoid tumors, and the Turcot syndrome characterized by by neuromas and paragangliomas.
Anything else? Anything else?
I remember this in the Gardner syndrome, desmoid tumor and mandibular osteomas, and there is one more thing actually.
Sebaceous cyst, yeah? Sebaceous cyst.
Sebaceous cyst, yeah.
You gotta mention that as well. On Turcot syndrome. All right, what's the management in this patient? Remember, she was relatively young female patient coming to you because her father died from colon cancer, and she was worried about, if she needs to do any genetic testing. What's your management here?
So we need to do an endoscopy and the biopsy, and
So
if it's
then endoscopy, and this is the endoscopy, as you can see.
yeah, okay, so
It's
yeah,
definitely more than 100.
so it looks like a FAP as well. So
Mhm.
if it's, I mean, if it's a confirmed FAP, so we need to do a total colectomy by the age of 20 to 30.
Right. So you want to consider the age total colectomy, like I said, by the age of 20 to 30. Yeah, total or near total colectomy, and actually 25, but I don't think it's going to be an issue if we say 30, but ideally you should say 25. All right. The patient had 2-year-old child. What are you going to tell her about that child?
The child will need to do screening, I think, by the age of 12.
So to start a screening at the age of 12 or to finish a screening at the age of 12?
To start screening.
Yeah, so you're gonna start screening by the age of 12. And again, your management plan will be probably prophylactic near total colectomy by the age of 25 if they are diagnosed with it. All right. How do you define endometriosis?
Okay, that's the presence of the endometrial tissue outside the uterine cavity in ectopic regions.
Okay. And how would you define metastasis?
Metastasis will be the spread of malignant cells outside the primary origin, and this might happen by lymphatics or vascular spread.
Yeah, but when I say that the metastasis, the reason why I remember that because basically endometriosis has a metastatic theory, right?
Yeah,
So basically metastasis is the ability of the primary tumor cells to grow and survive in a
out
tissue
of
that is distant from its primary site. Yeah. So
and
so you want to say that it's the ability of these cells to grow and survive and thrive away from its origin. Endometriosis is basically the same. It's the ability of endometrial cells to survive or live outside the uterus, or it's the presence of endometrial cells outside the uterus. So it's basically metastasis. Okay, so we mentioned one theory now, which is the metastatic theory, but there are two other theories. Can you mention them to me?
yeah. The metastatic theory, the vascular and the lymphatic theory, and the regurgitation theory.
All right, and how would you define an ulcer?
Ulcer is a gradual is a defect is a mucosal defect due to gradual disintegration of the epithelium.
Yeah, so you really want to say that ulcer is a discontinuation of epithelium. 3 words, right? Discontinuation of epithelium. That's it, right? What is the secondary intention definition?
It's the wound healing by re-epithelialization.
Okay. Yeah, it's healing of the wound by revitalization, contraction, formation of granulation tissue in the middle. Right. All right. What's the lifestyle modification to decrease the risk of cancer?
It's just increase the high fiber diet and stop smoking and alcohol, and try to reduce the constipation by increasing the fibers in diet.
Yeah. So yeah, correct. So reduce fat intake, stop smoking, increase fiber diet, sometimes decreased red meat as well. So yeah,
Mhm.
good one. So I think you've answered here pretty well. The only thing is try to revise the classification of polyps, neoplastic, non-neoplastic, and inflammatory, and also the malignant potential. Try to mention the subtitles. So you mentioned the size and so on, but try to mention the details. Yeah, and that's pretty much it for familial adenomatous polyposis. Cool. Let's go to